We will continue the anti-protozoal drugs, in which we are discussing about the Babesia, Anaplasma, and theileriosis, and some of the drugs, also the anti-trypanosomicidal drug. So yesterday we have discussed all about the diaminogen aceturate and the many more drugs which are effective against the both Anaplasma and theileria. So today, to continue with the old drug, that's the antimonial compounds, especially the antimony potassium tartarate is one of the drug which was older drug. It's called as the tartar emetic. Tartar emetic. Yes, this is a very interesting drug. Once upon a time, this was the only drug available for the nasal schistosomiasis. So this is highly toxic drug and need to be given slow IV. So then if it cannot be given by the route of the subcutaneous or IM, because it is highly irritant and the tissue used to slough off. But the older veterinarians, they were very much fond of this drug, and they were using the drug, and many times they have caused the death of the doctor induced or iatrogenic. So if a 2 ml is extravasated, especially this drug tartar emetic, antimony potassium tartrate, it's highly irritant and causes a very big swelling at the time of the injection. Because of this thing, this drug is totally discontinued. But for the reference purpose, that you should know what are all the drugs which are earlier, which are all the present. So for that purpose, we are teaching you particularly the antimony potassium tartrate. So it has been used as the expectorant. So in the expectorants, we have already dealt about this thing, and also a ruminatoric and enthalmitic and the anti-protozoal drug. And it has activity against some blood protozoa, including the trypanosomiasis, and it is rarely used nowadays because of the severe toxicities. And totally, it is, please remember that antimony potassium tartrate is used as a expectorant and also the ruminatoric, especially many bolus which are containing the ruminatoric, they are containing the antimony potassium tartrate and also some iron dextran preparations. And when there were no enthalmatics, very good enthalmatics, this was used to expel the worms. So nowadays it is totally withdrawn, and it has got severe side effects. That's the history of this particular drug is concerned. Then you need not remember the dose of this particular thing also. Just for your reference, we have put as T2 5 milligram, and it is dog to 1 to 3 milligram. So this was the drug which was used very extensively during the period of 1920 to 1992, about 60 to 70 years. Only the drug was available, and now it has reached into the history. So the another drug is the Stevofen, is a complex antimonial compound, organic compound. It has anti-filarial, anti-schistosomiasis, and anti-trypanosomiasis activity. Some of the spelling mistakes are there. Please pardon me for it. So it is rarely used because of its adverse effect and doubtful efficacy against the parasites. So just one announcement is there. Today I am going to give you the what you call as this thing assignment. All are requested to attend without fail, because the thing is you need to get very efficient in answering, and nobody knows whether these are all these may be considered as per the how the students are attending the quizzes and other thing. So please attend the quiz. So the timing, as you know very well. So the CR, please note the point that yes, all the students need to attend. So it will be from 6 p.m. to 9 p.m. it will be open. Then you can also share with the links with the other college students, but let them write their own ID number. That's also important. And Stilbofen sodium is rarely used nowadays because of its adverse effects and doubtful with efficacy against the parasites. So many of the dyes already yesterday we have listed what are all the dyes, and among these important dyes are the trypan blue and trypan red. So both of these things are there, and maybe the thing is, maybe because of this thing, the trypanosomiasis might have, the name might have been originated, whereas the trypan blue and trypan red were used earlier for the treatment of the trypanosomiasis. That's why the name trypanosomiasis or trypan might have come. I do not know whatever. Anyone of you can search the history of this trypan blue and get me back. So please take this as an assignment, number one. So these compounds are no longer used because they are neither safe nor effective as the modern drugs. So there is no question of the pharmacokinetic, toxicity, etc. So just remember that the trypan blue means trypanosomiasis. That's enough for the thing, for the academic sake. So the anti-giardial drugs are, many of the drugs are giardias, as you might know. So giardia is a flagellate protozoa that causes the infections in man and some animals, particularly in case of the dogs and cats. Of course, the giardiasis is also a problem in case of the human beings, because whenever you the persons do drink the contaminated feed and water, especially the dirty waters, and when you go and take a food from a hotel which is not non-hygienic in nature, so in such time you will get the infection. So the giardiasis, it causes the giardiasis, especially the diarrhea, etc., and some of the other hepatic giardiasis, etc. are there. So this is extracellularly, the lumen of GI tract will be affected and cause chronic diarrhea, the chronic weight loss, lethargy, nausea, and also the vomiting. And the giardiosis in many animals is asymptomatic. Then the life cycle of the giardia is direct, and it's very simple. The oocysts of the giardia are passed in the fishes, very similar to that of the Eimeria. So we can examine the fecal samples of the dogs, cats, or human beings and find the remedial measures. So we'll see what are all the drugs which are used to treat the giardiasis is concerned. And once ingested in feed or contaminated drinking water, the cysts break open and the tropozoites are released. And the tropozoites attach to the brush border surfaces of villus epithelium of intestine and cause the infections. And also the tropozoites reproduce by binary fission and get encysted. Encysted means they get cysted and are shed in the feces. So the giardiasis is one of the important in case of the zoonotic importance. That's why we need to be careful. So if you are especially you are having the dog and cat attachment, then be careful about the giardiasis. So they may transmit the one to the other disease. So the drugs, especially anti-giardiasis drugs, are classified as the nitroimidazoles, like the metronidazole, then dimetronidazole, and the tinidazole. So these are also anti-amoebic drugs, what we have discussed. Then second category is the benzimidazoles, albendazole, and fenbendazole. We have discussed about all these things. But the third category is the nitrofurans like furazolidone, then acridine derivatives like the quinacrine. So the thing is the nitroimidazoles are important group of the antiprotozoal agents with activity against the flagellates and amoebae. And some of the agents like the metronidazole also have the significant antibacterial activity. And please note that the metronidazole is effective against the anaerobic gram-negative bacteria. Maybe some of the gram-positive bacteria also, but they should be anaerobic. Then this group includes the metronidazole, tinidazole, ornidazole, then ronidazole, ipronidazole, benzidazole, then carnidazole, then dimetrazole, and nimorezole. So all these zoles, just like the pantoprazole and other thing, don't confuse with that of the proton pump inhibitors, the pantoprazole, omeprazole. So you should make certain charts, especially mnemonics, so that you can remember these drugs very easily. So the metronidazole is the most commonly used and the prototype drug of the nitroimidazole category. Nowadays, the modern agents like the tinidazole, secnidazole, ornidazole, these are all in the market. So we will see what are all those things. So coming to the first prototype drug, you should always remember the prototype drug. So the prototype drug for the, especially the aminoglycosides, the streptomycin, penicillin is the prototype drug for the beta-lactamases, and also the enrofloxacin or norfloxacin is a prototypic drug for the fluoroquinolones. And many more agents are there. Suppose it's the furosemide, it's the prototypic drug for the nitrofurantoins. So all this you need to remember one drug so that you can remember the other drug. Like if you remember metronidazole, like orinodazole, secnidazole, and other drugs, you can remember it very easily. So it occurs as a white to pale yellow crystalline powder or crystals. So that are spellingly soluble. It is yellow in color. This metronidazole. So please remember that metro is referring to the metro cities like Bangalore, etc. So these are water soluble and it's primarily a human drug, but has been used in many type of the domestic animals. It's available as the injection, then intrauterine liquid, etc. So the exact mechanism of this drug is unclear, but some suggestions are there. The metronidazole enters the susceptible protozoa by the diffusion and is reduced to an intermediate cytotoxic metabolite. And the active metabolite interacts with the protozoal DNA, where it causes loss of helical structure and the strand breakage. So interaction with the DNA also destroys its ability to act as the template for the DNA and RNA synthesis. So these are all the, what you call as, the mechanism of actions which are suggested. So still it is 100%, it is not clear. Maybe these are all the suggested causes. The cytotoxic intermediate then decomposes to non-toxic and just 1 minute. Just hello, ಹೇಳಿ ಸರ್. ಏನು ಸಮಾಚಾರ ಬರ್ತಾ ಚೆನ್ನಾಗಿದ್ದೀರಾ? ಹಾ, ಹಂಗೆ ಇದೆ ನೋಡಿ. ಇಲ್ಲೇ ಇದೆ ಶಿವಮೊಗ್ಗದಲ್ಲಿ. ಹೌದು. ಹಾ ಹಾ ಇಲ್ಲ, ಹೌದು, ಬನ್ನಿ, ಮೋಸ್ಟ್ ವೆಲ್ಕಮ್ ನಮ್ಮೂರಿಗೆ. ನಾನು ಮಾಡ್ಕೊಡ್ತೀನಿ, ನಾನು ಮಾಡ್ಕೊಡ್ತೀನಿ. ನೀವು ನಮ್ಗೆ ಇಷ್ಟೆಲ್ಲ ಸಪೋರ್ಟ್ ಮಾಡಿದ್ರಿ, 2 ಲಕ್ಷ ಬಜೆಟ್ ನೀವು ಮಾಡ್ಕೊಡಲ್ಲ. ನೀವು ಬನ್ನಿ, 22 ಅಲ್ಲ? ಹಾ ಸರಿ, 22 ನೈಟ್ ಹಾಳು ಮಾಡ್ತೀವಿ. ಹಾ ಬನ್ನಿ ವೆಲ್ಕಮ್, ಬನ್ನಿ. ಆಯ್ತು, ಓಕೆ ಬನ್ನಿ. ನಾನು ಇವತ್ತೇ ಬುಕ್ ಮಾಡ್ಕೊಡ್ತೀನಿ, ನಮ್ಮ ಕಾಲೇಜ್ ಹತ್ತಿರ ನಾನು ಮಾಡ್ತೀನಿ. ಆಯ್ತಾ? ಬನ್ನಿ, ಆಯ್ತಾ? ನೀವು ಇಲ್ಲಿಂದ ಬರ್ತಾನ, ಇಲ್ಲಿ ಬರ್ತಾನ? ಹೌದಾ? ಬನ್ನಿ, ಈಗ ಒಂದು ರೂಮಲ್ಲಿ ಇರ್ತೀರಂತೆ, ಬರೋಕ್ಕೆ. ಆಯ್ತು ಆಯ್ತು, ಹಾ ಬರ್ರಿ, ನೀವೇನ್ ಕತೆ ಅವಕಾಶ ಎಲ್ಲ ನೋಡ್ಬೇಕು, ನಿಮ್ದೇನ್ ಸಮಾಚಾರ? ಬನ್ನಿ ಫಸ್ಟ್. ರೂಮ್ ನಿಮ್ಗೆಲ್ಲ ವ್ಯವಸ್ಥೆ ಎಲ್ಲ ಊಟಕ್ಕೆಲ್ಲ ಮಾಡೋಣ, ಬನ್ನಿ ಫಸ್ಟ್. ಇಲ್ಲದಂಗೆ ಇಲ್ಲ ಆಯ್ತಾ? ನೀವು ಬನ್ನಿ, ನೀವು ಕೃಷ್ಣಪ್ಪ ಮಾಡಿ ಬನ್ನಿ. ಆಯ್ತಾ? ಹೌದು, ನೀವು ಬನ್ನಿ ಫಸ್ಟ್. ಹಾ ಆಯ್ತಾಯ್ತು. ನಾನು ಬನ್ನಿ ಫಸ್ಟ್, ಆಯ್ತಾನೆ? ಇಲ್ಲ ಬರೋದೇ. ಆರಾಮಾಗ್ತೀನಿ, ಎಲ್ಲ ಊರಲ್ಲಿ ಹೀರೋ ಮಾಡ್ಬೋದು. ಸರಿ ಸರಿ. So Honorable Vice Chancellor was on the. So many anaerobic bacteria such as the Bacterius fragilis and the Fusobacterium species and the Clostridium perfringens and Helicobacter pylori and anaerobic streptococci are sensitive to the metronidazole. And clinical resistance to the metronidazole has not been developed among the parasites, but decreased responsiveness of some of the Trichomonas species have been observed in some of the areas. Then pharmacokinetic property, especially the metronidazole is a liphophilic agent and is relatively well absorbed after oral administration. Then the oral bioavailability of this metronidazole in animal is it's varying from 50% to 100%. So the metronidazole, many of you may have, whenever you are having the diarrhea and other thing, you might have tasted this particular drug also. It causes a lot of metallic taste. You will not have the sensation of the taste at all. So this, if it is given in the food, absorption is enhanced. So this is very important because with food, most of the drugs, their absorption is decreased. Whereas in case of dogs, the drug is absorbed more in presence of food. And especially this is due to the increased secretion of the bile because this drug is soluble in bile. And the peak plasma concentration or peak blood levels about half an hour of the ingestion of this drug occurs, and it has a very low protein binding, whereas the many of the drugs like the buprenorphine, etc., they have got very high plasma protein binding. And the even though it is not having the low plasma protein binding, it is very well distributed in body tissues and fluids, including bone, abscesses, CN, and the seminal fluid. So the metronidazole is primarily metabolized in the liver by hydroxylation and conjugation process. So both metabolites and unchanged drug are eliminated in the urine and feces in about the 24 hours. So if you take today, then tomorrow if you administer it to the animal, so the body will be totally clear of the metronidazole for 24 hours. So following the high doses, especially the color of the urine may become dark due to the presence of the metabolites. So the many of the time this furazolidone and metronidazole, they are combined together. So the furazolidone also secretes certain metabolites which are dark yellow in color, and metronidazole also. So this gives a tan brown color to the urine, and one need not worry about these things. This is due to the metabolites. And there is a drug like the phenazopyridazine. It causes the dark yellow color of the urine and sometimes the pink color of the urine also. So one need not worry. But while advising these drugs to the pets, you should warn the owner or caution the owner that the next day the urine color will be like this, or else they will start murmuring and calling you repeatedly. And low concentrations of the drug may be seen in milk and saliva. Then elimination half-life of the metronidazole in animal is 4 to 5 hours in dogs and 3 to 4 hours in case of the horses. Then side effects of these drugs are especially adverse effects. Metronidazole is generally well tolerated at recommended dosages in dogs, but may cause GI disturbances like anorexia, vomiting, and also the diarrhea. And high dosages may produce the neuralgic disturbances characterized by the tremor and the weakness. And also there is lethargy and the nystagmus. So this is seen in case of certain calves. If you administer the high dose, if they are suffering from the giardiasis, then there is all these clinical signs are observed. Then there is a disorientation, then head tilting and seizures will also be done. And in some cases, the neutropenia, hematuria, bradycardia, etc. may be observed either with high dosage or repeated recommended dosage. And because of these metronidazole affects the DNA synthesis, it may have teratogenic effect or carcinogenic and mutagenic effects. And yes, this need to be cautioned, especially the metronidazole is proved to have the carcinogenic, especially in case of mice. So the prolonged dosages are always not recommended. Then the treatment for this toxicity is, it is totally asymptomatic. You can administer the fluids and you can administer the B complex vitamins, and also the neurological signs may require several days before showing the signs of the resolving. So it takes long time. So these need to be thought when you are giving this drug for prolonged use, especially for 10 to 15 days or more, then only all these clinical signs will be seen. If you are administering the drug intravenously for 3 or 4 days, nothing is going to happen. But in some animals, you need to have such cautions also. Then contraindications are listed like anything. That's what I was discussing with many of the faculty members. That's why the allopathy is said to have the allopathy means, please correct yourself. If you are calling the allopathy, it is not the thing. You need to call the modern treatment, allopathic treatment, as the modern medical science or modern veterinary science. That's what the correct terminology is there. So better not to call as the allopathy. Allopathy include all the things. It includes the naturopathy, then the Ayurveda, except the homeopathy. Homeopathy, approximately, it is not the allopathy. So it should not be used in weak, debilitated, pregnant, or nursing animals. So it should be used with extreme cautions, and in case of animals suffering from the neurological diseases, hepatic dysfunction, and also these are all the neurological disorders, hepatic dysfunction, and many more are the side effects, including the blood dyscrasis, means that there is a aplastic anemia will be there. And as the nitro compounds are suspected to mutagens and carcinogens, so this should be provided, especially in case of the food animals. And drug interactions, yes, it shows the interaction with so many drugs. Because why I am dealing in detail about this metronidazole is, this is a very commonly used drug. It prolongs maybe metronidazole or its congeners. So it makes the same. The little toxic effects and other things are different. That's all. It prolongs the bleeding time in case of patients taking the warfarin. So of course, this is not a case in case of dogs and cats, only restricted to the human being. So the macrosomal enzyme inducer like the phenobarbital sodium may enhance the metabolism of the metronidazole and decrease in blood concentration. Whereas the cimetidine, of course, it is banned in case of human use as it causes the gynecomastia. So this will reduce the metronidazole metabolism and increases the likelihood of the dose-related effects, especially the disulfiram, like intolerance. So a person, if any of you are having a lot of alcoholic, etc., you can think it up, or else please neglect it, or please suggest any of your seniors or friends, like it is going to cause a disulfiram intolerance, like intolerance to alcohol. So disulfiram is a anti-addictive drug. So what happens if you use the disulfiram? It is going to bind with that of the alcohol or the aldehyde dehydrogenase. So ultimately, the end product, the acetaldehyde, is formed, is having a lot of side effects. So the person who takes the disulfiram along with the alcohol, so many times it happens in the familyhood, the wife dissolves the tablet disulfiram in the whiskey or rum or gin, whatever it may be, the alcohol content, and he will feel lot of bad effects or hallucinations and many more. So the alcohol addicts may come out of that particular thing. And so this will happen, especially when you administer the drug to humans taking the alcohol, metronidazole. And metronidazole is widely used in case of human and small animal veterinary medicines for the treatment of the giardiasis, amoebiasis, and also the trichomoniasis. So trichomoniasis is the one which is caused by the trichomonia microorganisms, which cause abortion in case of the cattle. And metronidazole may also be used for the treatment of the histomoniasis and babesiosis, but is efficacy is unreliable, and it is effective against the anaerobic bacterial infections, only anaerobic, not the other thing. So suppose in case of intestine, there are certain infections, it's called as the anaerobic microorganism. So this can be effectively treated using the metronidazole is concerned. And it is commercially available as the tablets, oral use, suspensions, IV injections, and also available as the intrauterine treatment. Please remember here that the metronidazole is sometimes combined with the povidone for the intrauterine treatment. Please never follow this procedure in your lifetime because it causes the severe adhesion of the uterus, especially the cervicitis is caused. You might have attended certain camps also. Many vets have got the habit of administering the metronidazole with that of the povidone, the iodophor. Then the dose of the treatment for giardiasis and trichomoniasis is 20 milligram per kg orally and subcutaneously. Just remember that metro means 20. In case of metros, you can only travel with 20 kilometers of speed. That's how you can remember the dosage. So 20 kilometers of the this thing milligram per kg orally is the dose of the metronidazole. And amoebiasis 3 times the dose. So in case of the highways, you can go up to the 60 kilometers per hour. That's similarly 60 milligram per kg. Just for the remembering this thing. And the anaerobic infections, just like the histomoniasis and trichomoniasis, giardiasis, etc., this is administered as 25 to 50 milligram, and horses 15 to 25. Then in case of birds, the more dose is required. Please remember that usually the dose is doubled in case of the birds, as the body basal metabolic rate BMR is very high in the birds. The body temperature itself in case of the poultry is 107 degree Fahrenheit. So they may require more and more quantity, but we cannot generalize this thing. Then dimetronidazole, all the properties and the other things are very similar to that of the metronidazole. It's a broad spectrum antiprotozoal and antibacterial agent. So this is mostly used in treatment and prevention of the histomoniasis and the trichomoniasis in birds. Of course, this is used in birds, and treatment of the giardiasis is less. Of course, it is a brief pharmacology and dosage are given in the antihistaminial drug, and in future we are going to study this thing. Or else what we can take, especially all these, maybe the dimetronidazole, metronidazole, tinidazole, all are belong to the same group, that's the nitrimidazole group, with similar pharmacological actions of that of the prototypic drug. You should remember always the prototypic drug and compare it with that of the prototypic drug. And the metabolism is completely slower and is claimed to be better tolerated than that of the metronidazole. So it is mostly used in case of human medicine for treatment of the giardiasis, trichomoniasis, amoebiasis, and some anaerobic infections. It is used. Then benzimidazoles, the benzimidazoles are the group of the broad spectrum anthelmintics. So we have studied the mechanism of action and also almost all the pharmacokinetic properties and other things in the earlier chapters as a anthelmintic or anti-nematodal drug. So some agents like the albendazole and fenbendazole have antiprotozoal action and are used in small animal practice. So the albendazole, already you know that this is a broad spectrum anti-anthelmintic commonly used for as the anti-nematodal drugs and anti-trematodal drug. It has got, albendazole has got the effect against both the nematodes and trematodes. So instead of administering two separate drugs, that is the advantage of the albendazole. But there is only one side effect is it should not be used in pregnant animals. So it is very effective in treating the giardiasis of the dog, albendazole. So you can administer albendazole and get rid of the giardiasis, then the tapeworm infestation, and also the anti-nematodal drugs. So this is benefits of the albendazole. Then antiprotozoal action is produced in case of its many metabolites, that the albendazole sulfoxide and the sulfones. So this drug, please remember that you need to remember the albendazole because it is one of the good drug in case of cattle, but it is shown to be teratogenic in case of mice, and thus to the pregnant animals you should not use the albendazole. So all these need to be remembered by you veterinarians, and this is the only difference. If you are very thorough in pharmacology, you can make the real change, because the livestock inspectors or your own colleague might have forgotten, and you can say that this drug should not be given in the pregnant animals. So albendazole should not be used in pregnant animals, but it is effective against all the three. The pharmacology already we have dealt about the adverse effects of these drugs in the earlier chapter. So we will only restrict ourselves what is the dose of this drug in the treatment of the giardiasis. So the dose is 25 milligram per kg. That is 2 times daily for maximum 2 to 3 days. So as an anthelmintic, single dose is enough, whereas the anti-giardiasis, it requires 3 days to administration with BID. So the fenbendazole, you know very well about one of the most safest anthelmintic belonging to the category of benzimadazoles. So it is used for the treatment of the nematodiasis, and of course it is not having much action on the other parasites, maybe antitrematodal or anticystodal, unlike the albendazole. So it has very good activity against these giardiasis in dogs and has got very good margin of safety and well tolerated. Even you can administer the dose. Of course, the anthelmintic dose is 10 milligram. Here you need to administer 50 milligram per kg orally once daily for 3 days. It need to be administered orally. And the nitrofurans, of course, the furazolidone is a synthetic nitrofuran approved for the treatment of the enteric infection. So even though the modern drugs have arrived, many practitioners still today use the nitrofurazolidone or the furazolidone for the treatment of the giardiasis and also the non-specific diarrhea for the secondary bacterial infection. So it's a approved drug for the treatment of enteric infections. So in India, we are not bothered about whether it's a FDA approved or not approved like that. But in case of US, if you are a veterinarian and in case of the food producing animals, only the FDA approved drug should be prescribed, or else you will be sued. That's why also you need to learn the toxicology and pharmacology there. And it also reported to have the anti-giardial activity and used for the treatment of giardiasis, especially in case of the cats. And unwanted effects of this recommended doses are limited, and toxicity is characterized by the gastrointestinal disturbances. So it's like the peripheral neuritis and the decreased weight gain. Dose is cat 4 milligram per oral 2 times a day for 7 to 10 days. Then accredited derivatives like quinacrine, they are also effective against certain hematoprotozoa, this protozoan diseases like the broad spectrum antiprotozoal activity against the Giardia, Coccidia, and the Plasmodium species which are causing the malaria, etc. And it acts directly on susceptible protozoa and interacts into the intercalates into the DNA. That's the mechanism of action, and it is usually administered by oral route, but may be given parenterally, or the intramuscular route is also recommended. Then it is rapidly absorbed from GI tract for the intramuscular injection and site, especially IM site, and is widely distributed through the body, slowly excreted in the urine, causes nausea and vomiting, and some of the disturbances, especially the blood diastasis, urticaria, dermatitis, etc. The commercial production has been discontinued in some countries due to its adverse effects, and the availability of the modern drugs is also there.
Excuse me, sir.
Yes.
Sir, at 3 o'clock we have extension class, sir.
Extension, I have requested them to wait until 3:30. I requested Dr. Harish and Dr. Gopal also. It's okay. I have informed them.
Sir.
I have requested. Don't worry about all those things. Thank you for the information. So what about the syllabus? It is completed or not?
Not yet, sir. Still 2 units are there.
12 units, 2 units. Okay.
No 2 units, sir.
So 3:30 is, I have instructed or requested him to take at 3:30 because Dr. Gopal and myself, we went to meet the minister, Honorable Minister for the development of Veterinary College Shimoga and the various funds, etc. So he has been requested, and don't worry about that thing. Okay. Puppy is 50 milligram orally. Then antihistamine drugs, histomonas, that's the melagridis. It's a small flagellate parasite and the flagellate parasite of the turkeys and fowls and quails and the pheasants. So it mainly affects the cecum, then a site from which it is affecting, and also just a bit. I'll call the Dr. Harish. No, the class is from 3:15, no? 3:15 to 4:15. Is it not? Extension class?
Yes, sir.
Then
But sir, message join the class before 3 o'clock.
we can put, because anyway, we'll talk now only. You have received the message now?
No, sir.
No, yesterday's message or today's message?
Sir, at 2 o'clock, sir, send the message, sir.
Okay. Later I have talked with him. After that only I have talked. But no, anyway, we'll have, because the official class is from 2:15 to 2 to 3:15, no? 2 to 3, and 3:15 is the extension. Am I right? So I will finish
Yes,
within
sir.
10 minutes. Okay, thank you. Histomonas is also, the blackhead disease. It's called as the blackhead disease. Under the natural conditions, the Histomonas is characterized by oral ingestion of the eggs as usual. Then antihistamine drugs, like classified as the nitropiozoles, aminonitrosols, and the nithiazide. So the dimetrazole is also belonging to the class of antihistamine drug. And nitropiozoles, two compounds of this group, namely the aminonitropiozoles and also the this nithiazide, are available for the treatment of the histomoniasis. And aminonitrosols are the first specific drug introduced in the treatment of the histomoniasis. That's the aminonitropiozoles in turkeys, especially the 1949. So this drug is having bitter taste, odorless, then having odorless, but it is having the yellow fluffy powder. So this is highly a little bit not at all tasty, and the aminonitrosol has good activity against Histomona species, and both used therapeutically and also the prophylactic. So another 10 minutes. Okay. Prophylactic use is also possible. Then the treatment for the histomoniasis, it requires 0.1% in case of the feed. Of course, this is useful in the turkey diseases. And nithiazide is one of the another drug, antihistamine drug, commercially available for use in turkeys. So these are drugs, especially these are useful in the turkey treatment, very specific diseases of the turkeys. When if you are looking after a turkey farm, etc., some have fascinated toward this thing. So you can use this particularly these drugs. So the last category is nitrometazole and dimetazole. Once again, we have already discussed. So it is against the Treponema. That's the Treponema species of the this parasites, especially Hexameta melagridis and Treponema gallinarum, especially in case of turkeys. So the swine dysentery, the Treponema is also infectious, causes the swine dysentery and useful, especially in case of swines. So these RNA synthesis inhibitors and this year dimetazole, already we have discussed in the giardiasis. So this is used for the pigs, piggery farm. In case of dysentery, swine dysentery, by the treponema. So the dimetronidazole should not be administered concurrently with other drugs like the metronidazole. Then withdrawal period is 7 days usually. So for turkeys, it is used in 100 to 200 gram per ton of the feed, and guinea fowls, peasants, etc. They are being used for the treatment of the histomoniasis. So last one is the miscellaneous drugs. That's the nefurozole. Nefurozole, that it appears to act by causing the damage to lipids and DNA within the protozoal cells. And the withdrawal period, please remember that most of the antiprotozoal drugs has withdrawal period of 5 days. Then turkeys, it is 15 gram per ton of the feed as a antihistaminious drug. That's about the, especially the antiprotozoal drugs, and we will discuss about the vitamins and other things, especially in the forthcoming classes. So that's the vitamins, and only few are remaining. Especially only few drugs are remaining in the chemotherapy, and we will start the toxicology as early as possible. So nothing to worry, we are far ahead than the other many veterinary colleges. I think today you might have received the timetable. Then 10 August till 10 August your semester is there, and within that we need to finish almost all the syllabus. So you might have seen the circular. Have you received the circular from the registrar? Especially
No, sir.
No. So I will share it in the group. Okay. So
Okay.
Sir, then what about practical, sir?
Need to be started. That's what the university circular says. And we need to finish up all the syllabus, and we will do it. There is no including the exams, if any, and whether they are the offline or online, nobody knows. Okay. Anyway, be studying very well, and we will think and attend the quizzes and other thing, which may become very crucial for you. I do not know, because the many teachers have been instructed to take the attendance very properly and submit it to the dean, because the Shimoga is the one, I think, not to say most of the students are attending, even though there are absentees are there. So the university will take certain decision in this as early as possible. There is a board meeting on the 22nd, and by that time some decision will be taken, and be ready to come as early as possible, so that we can have the examinations, etc. offline or maybe online. Be ready for that particular thing. So you can log out now, and thank you very much, and log into the, I will inform the Dr. Harish to take the class in as usual in the due time. Okay.